and good day to Dr. Asam. My name is Aisha Mohammed Kulatin and I am here today with my group to present on the client's rights and counselor's responsibility in therapy. So first of all, I'm going to talk about the client's legal rights in therapy. Because in some situations, just thinking about seeking professional help and planning out how you're going to go to therapy is a very tedious thing. It's a very intimidating thought for some people, and these rules have been set in place in order to make it a bit easier for them, in order to give them the comfort that we are here to protect you in case of anything. These rights are an insurance to the client. They are legally binding rules that will allow them to have access to humane treatment during their therapy sessions, and they will be allowed to make their own choices in any situation, and all the information that is being shared will be kept anonymous between the client and the counselor and will not be shared to any outsiders. So the first legal right of the client is that they are allowed to have a filtering process where they will look through all their possible therapy options available to them. They will filter through the most suitable ones for their therapeutic needs and then decide whether they want to go this one or there. And then in this process, they can also ask for the counselor's educational qualifications and professional experience in order to know how far have they reached in familiarizing themselves with the situations such as theirs, and even asking for their national certification and licensing to know their level of expertise in the field. It just provides a sense of comfort to know of their qualifications. And another thing that the client can ask for is the counselor's basic code of conduct, which basically includes a detailed document of the therapist's working system in terms of their therapy strategies, in terms of their emergent procedures that they uphold, in terms of their fees that they charge, and even allowing the client to figure out that the route that they're going to take, to evaluate the basic potential risks and benefits of going to this therapy session, if they need to plan out their financial status so that they know they can afford the luxury of going to therapy as well as manage their personal lives and work together with that. So overall, the therapeutic relationship between a counselor and a client is very confidential, meaning that the client has the freedom to get their information kept hidden, other than the situation where there are state laws and ethical standards of psychology requiring the counselor to give out information on the client in the situation where one of these circumstances may arise. So their circumstances include when the client poses a possible threat of harm to themselves or to someone else. A second situation is if they have been a victim of sexual harassment from a previous therapist that they went to, which could be one of the signs that they are suffering from a traumatic experience, and that's why they're withholding themselves from reaching out and going to therapy one more time. If the client is a minor and they are not emancipated from their parents, they're not legally separated from their parents, and they're not independently living on their own, and they need their parents' consent to go ahead. Or if the victim is suspected a case of a child abuser or a domestic abuser and has to be reported, or if this therapy session has been a court-ordered session that needs to be reported to a higher legal authority in terms of reporting the client's progress through the sessions, and also if the client is pregnant, or if they are suspected to be drug abusers using felonious drugs such as heroin or cocaine and such. So the other client's rights and responsibilities in therapy include having the right to be treated with respect, dignity, and consideration by everyone around them, having the right to choose to change your provider, or even receiving service from a differently experienced practitioner to be able to compare between the two techniques, or having the freedom to be communicated with, making sure that the counselor informs them of all the treatment options that they take, of all the costs that are incurred, and all the supplies that need to be implemented into their therapy sessions, so that the client comes in fully prepared, knowing what to expect and such. And also they have the choice to say no to a service if they think that this goes against their beliefs in any way. And also they have the right to privacy and confidentiality of whatever information, whether it's personal or in any way, whatever information that they share, they have the right to keep it private and anonymous until or whether they allow it to be otherwise. And other rights include that they should be respected and they should be treated the way that you would treat any other normal person. And also they have the responsibility to actually reciprocate that with other staff and other clients, and act in a very upholding, respectful manner with other people around the service, and also disclose every relevant medical information about themselves without hiding anything, because this might all prove to be relevant during the therapy sessions or otherwise, because there might be a medical situation that they have that they're disclosing, and it might affect how the treatment option should be going. And also the client is responsible for acting very consistent in their therapy sessions. They have to be very active and follow up with their checkups and procedures every time, and they have to be on time with their follow-up appointments. And if they cannot keep an appointment, they have to notify the service provider as soon as they can, so that they can arrange for reschedule or finding a situation where they can repay back this session, so that it is not affecting their overall treatment or overall therapy, because one session might be holding the whole thing together. And if they miss this appointment, they should be assured that we are gonna do something to recover this, and that it's not going in vain. Thank you.
Hello, madam. My name is Soumya Nokhe, and I'll be talking about the client's ethical rights. So, for the client's ethical rights, the client should obtain a copy of the codes of ethics that the counselor is following, and then the client should ask questions about confidentiality and its limits as it is specified in state laws and professional ethical codes. Since there is client's rights, there is client responsibility as well. So the client should establish a schedule. For example, if the client cannot come to the session, he should make a call or contact the counselor as soon as possible, and pay the bill in accordance with the billing, like the billing agreements, and follow be respectful to the counselor and the staff, and follow agreed upon goals and strategies established in each session, and inform progress or challenges that he is facing in achieving the goals, and participate fully in each session, so that can help maximize to get a positive outcome. And clients also should inform the old counselor if he or she is seeking mental health services from a new one, and the client should consider referrals from the old counselor, so that it can help him to achieve goals in the future, and also avoid placing the counselor in ethical dilemmas. For example, asking for the personal phone numbers from the counselor, or having an emotional attachment like an affair relationship with the counselor, something like that. Um, so what? So for the next slide, so what if the client is not satisfied with the service? So the client can express concern directly to the counselor, or he or she can seek the advice of the counselor supervisor if the counselor is practicing in a setting where the client can receive direct supervision, or the client can terminate the counseling relationship if the situation remains unsolved, or uh, the client can contact the appropriate state licensing board or national um, certification organization, or professional association if the client think that the counselor contact to be unethical. So this is all for my part, and my friends will explain you more on, I think, counseling responsibilities. So thank you so much.
Brianna, and today I'm going to be talking about the counselor's responsibilities. So let's get down to the basics. Who is a counselor? So a counselor can be defined as a person who is professionally responsible for empowering the accomplishment of a client's mental health, such as dealing with diverse matters like family dynamics, personal griefs, and any other matters that might induce stress. Counselors can help people to overcome their problems and cope with tough situations by providing a safe and confidential and encouraging environment in which to contemplate their emotional state. So, what is the moral rights of a counselor? So, getting down to it, the moral rights are based off 5 ethical principles. So, a counselor needs to consider the principles of morals and ethics while solving ethical issues. So, the main 5 ethical principles are non-maleficence, beneficence, autonomy, justice, and fidelity. So, I'm going to explain to you a little bit about each of the 5 ethical principles. So, firstly, let's start with autonomy. So, autonomy means that patients are allowed the liberty to choose medical therapy options and by observing risk and benefits as well as their situation and personal values. So, this means that the client should get full control over the choices that they make in their therapy. So, next, let's go into the non maleficence and beneficence. So these are important principles of ethics that assist the clinical patients, that assist the clinical practice and research of mental health professionals. These principles require professionals to promote the well-being of their patients and their participants while attempting to keep them from harm or causing harm to them. So for the next one, we'll go into justice. Justice mainly means for therapists to have responsibility responsibility to be fair and impartial. So this principle states that people have a right to equally access and benefit from advances made in the field of psychology. So this means that a therapist or a psychologist cannot be impartial based on race, sexuality, or anything. All patients should be given the same right to benefit from the advances made in psychology. So the last ethics is fidelity. So the APA suggests that psychologists have a moral responsibility to help ensure that the others working in their profession should uphold high ethical standards. So this principle suggests that psychology should participate in activities that enhance the ethical compliance and conduct of their colleagues. So what are the legal duties of a counselor? So firstly is the duty to warn. Therapists and counselors have the right and are required to break confidentiality if they believe that their client may pose a harm to another individual. So the clinician will actually will not face consequences for breaking confidentiality if they are suspicious that a client might be a threat to themselves or to other individuals that are in society. So let me give you some examples of duties to warn. So any information that is not related to the case, which was shared during the session, should not be disclosed to authorities. So many people continuously debate about what is actually considered of a threat that is actually credible or what is considered of a threat that is not credible. So in situations where threats are specific and direct with intention to harm another individual is a cause for concern. But in other cases, it may not be so clear, and it's up to the therapist to decide to the best of their abilities which is a serious danger and which is not a danger. So some examples where a therapist would need to actually consider their legal and ethical obligations are if a client does not specify a name of an individual, but mentions that they want to kill a colleague. So a therapist would have to think whether this is a threat or not a threat. A client mentions that they have an intent to kill a specific person, however, they say that they will not really do it. And a client has the means to commit harm. They may own firearms, but they do not make a threat, but they express an extreme anger towards a specific individual. So in these cases, the therapist would have to decide based on their own legal and moral obligations whether they should report these to authorities or whether they should just sit and wait and watch it out. So an assessment of threat is analyzed almost the same way as a potential suicide risk. So the next is credentiality. Sorry, I can't pronounce it. It's pronounced as credentialing. Is extremely vital to acknowledge the legal issues concerning the field of counseling. Licenses are provided by the state to protect society from therapists that are unqualified or untrained. There are laws in place that does allow for the practice of counseling by individuals that are not properly qualified or trained. So even to practice as a private counselor, a license is actually required. So next, let's go more into confidentiality. So a counselor should provide private client communication. Client confidentiality should be attempted to be maintained as much as possible because it affects the client-counselor relationship. So in the first session, before therapy even begins, a counselor should inform the client that confidentiality will not be broken unless it is absolutely necessary. The counselor should always get this consent form in writing from the client, just to prevent any any legal problems later on. They should always get it written down. So in cases where counselors are required to seek advice from another counselor, they are actually required to seek approval from their clients beforehand to make sure that they're all right with it before proceeding to reveal their case to another counselor. And furthermore, as much as possible, they're still required to maintain confidentiality to a certain extent, where if they can, not mention their name or not really open up certain details about the case. So the counselor is only supposed to reveal details of the case that is absolutely significant while asking advice from another counselor. So breaching confidentiality can actually result in a loss of license. So in cases where a counselor breaks confidentiality without any possible reason, they can actually lose their license. Thank you.
Hello, good day everybody. For my part, I'm going to explain about the case study. So for our group, we take 3 case study. And for the first case study is about the client that has been in the therapy with the therapist M for weekly for 6 years and has already resolved her presenting issues. Her emotional status not changed in approximately 4 years, except she has developed a growing attachment to therapists. Therapist M has not strongly recommended the termination. Rather, his attitude is, if the client thinks she needs to see me, then she does. So for the analysis, for this case is, for the analysis, actually the therapist M actually failed to ethically terminate treatment at the time. Client did not need to continue the services and the therapy was no longer beneficial to the client. The possibility exists that the therapist M facilitate client's dependency, prolong needless therapy, thereby suggesting exploitations for financial or emotional fulfillment. He is wise to critically evaluate the therapy process with client and refer client to a different therapist for consultation regarding needs for further therapy. Okay, there's a three reason where therapist can terminate the client or to refer a client. Okay, the first reason is when the issue resolved. Okay, when therapy has successfully resolved clients presenting issues and treatment is no longer required. And then second reason is the treatment is no longer beneficial. Client is not gaining any benefit from therapy, but is willing to continue given dependency upon the therapist, and a referral is possible if therapist sense client would benefit from a different practitioner. And the third reason is the treatment harmful to client. Okay, therapist believe if she or he continue the treatment, it be harmful to client, and a referral is also possible. In addition, therapists can discuss the issue of termination with clients truly, along with clarifying the reasons and decisions to terminate the therapy is based on the best interest of the client. Hence, therapists do not abandon the client. For case study 2 is the situation where therapist working in a mental health agency and he gave client a personalized pre-made informed consent from before the session began. During the session, the client, a young mother, revealed that her husband gets angry when their infant daughter cries and severely shake the child to stop the crying. Therapist advised client that he must report her husband's action as possible as child abuse, along with potential outcomes of the report, and that he will continue counseling her. Client responded that she would not have revealed the situation had she known it will be reported. Therapist reminded client that she signed the informed consent, from which clearly stated therapists are legally obligated to report incidents of suspected child abuse. Client admitted to not having read the document. Instead, she signed along with the other paperwork for insurance purposes. Client chose to discontinue therapy because she lost trust in therapists. The analysis for the case study 2, by right, the therapist should make the effort to ensure clients understand that which they have read in the disclosure statements. Informed consent form can be used to correct misunderstanding before therapy begins. Additionally, written rather than verbal disclosure statements are more effective in addressing questions or issue because the intent of the parties is clearly expressed. In the past, studies shown that counselor cannot rely exclusively on standard form to complete the purpose of informed consent, regardless of the quality of the form. Dialogue is required to ensure client and the therapist understand their upcoming share encounter. In the case of client who lack the capacity to give informed consent, for example, like a kid's developmentally disabled, severe thought disorder, or those who not speaking the primary language, in all of that cases, therapists must take an additional step to promote understanding for the client. Informed consent is a medium of communication between patients and their healthcare provider, either therapist or counselor, that often leads to permissions or agreement to undergo the treatment. There are 4 principles of informed consent. First, client must have the capacity or ability to make the decision. Second, therapist must disclose information on the treatment, procedure, or test in question, including the risk and expected benefit and the probability that the risk and the benefit will occur. Number 3, client must understand the relevance of information. And number 4, client must willingly grant permission without any force or threat. Therapists are compulsory to make sure client able to make a decision. Decision-making capacity is often referred to by the legal term competency. It is one of the most important components of informed consent. Decision-making capacity is not black and white. Some clients may have the capacity to make some decisions, but still have clients who are unable to make decisions because of other factors. The components of decision-making capacity that therapists must make sure are client's ability to understand the options, client's ability to understand the consequences of choosing each of the options, and client's ability to evaluate the personal cost and benefit of each of consequences and relate them to their own self of value and priorities. If client is not able to do all of the components, family members, court appoint guardians or other as determined by state law may act as surrogate decision makers and make decisions for them. Decision-making capacity are designed to make sure a client can understand everything stated in the informed consent, able to bear the implication, and able to provide concrete reason why they, as a client, willing to participate in the treatment.
This is a case study in which a woman who was diagnosed with epilepsy and multiple personality disorder went on to file a complaint against her therapist to the APA Ethics Committee, claiming that the psychologist was acting outside her area of competence, because the client claimed that even though she had been going to the psychologist for 4 years, her situation worsened in a way that they had to be hospitalized. So they claimed that the psychologist did not have the proper training and supervision to take care of her situation. When the psychologist was asked to present her argument, informed that they began treatment and working as an employee at the community health center, and they were under the consultation of a neurologist and 2 clinic supervisors who controlled the client's medication. And after 3 years, the psychologist decided to start a private practice. And when she sought the advice of a clinical administrator who was not a professional psychologist, advised them that they should take the client with them to their private practice. But once they went to their psychiatrist, they were advised that they should keep working under the clinic with the client so that it does not disrupt the client's treatment plan. But the psychologist took the clinical administrator's advice and took the client with them to their private practice, where they did not have the proper facilities and the experience and the expertise to work the same way that they did in the clinic. So 6 months in, the client situation started going down and their health started deteriorating, where they needed to be held captive by the police because they were having suicidal thoughts, and they were taken to a psychiatric center to be admitted, and in a way where it led to the clients refusing to see the psychologist anymore, and they ultimately returned to the previous community mental health center for therapy with a different practitioner. So the psychologist's argument is that they had acted professionally and responsibly, as it was witnessed by the consultant and the psychiatrist at the clinic, as they were recommended. They followed the advice that they were given. But the APA Ethics Committee found that the psychologist was in violation of the principle of competence and responsibility, because the psychologist tried to operate with the client beyond their limits of competence and mistakenly judged the client's situation in her favor, where they were supposed to deal with the client in a more structured, experienced, and proper environment with trained staffs and proper facilities, as the psychiatrist had advised. The psychologist did not want to take full responsibility for the consequences of actions, so she was mandated to go through 2 advanced course of organic disturbance and diagnosis and treatment of borderline personality as well as multiple personality disorder, in which they accepted this stance. And in the reason why therapist competence to deliver psychological treatment is important is that it ensures that the clinicians are held responsible to provide the best care to their patients. They are also they need to disseminate the evidence-based psychological treatment that the client needs, and it also arises from the concerns that the research on psychological treatment can be valid, but then it also needs to be seen as the true standard of implementation. They need to assess the implementation of the psychological treatments accordingly so that it suits the client's needs as they are going through the therapy, and not just look at what is best for you as a professional, but look at as the client and look at their situation and what you should do best to help them. Thank you. That is all from us.